Thank you all for joining us. My name is Christy Wells. I am the CEO of Safe House Project. We are honored to have you here today for our webinar, and I am going to turn it over to Bill Wolf, who is going to be guiding us through today's conversation.
Awesome. Thank you, Christy, and good afternoon or good morning, wherever in the world you are. We'll just start with a little bit of background, and then we'll dive into our amazing panelists today. As Christy mentioned, my name is Bill Wolf. Just by way of background, got into this human trafficking space during a career in law enforcement, and then transitioned to the U.S. Department of Justice, served as Director of Human Trafficking Programs, and also Acting Director of the Office for Victims of Crime. And it is my very distinct pleasure in my current role to be working alongside some amazing organizations, including Safe House Project, that just does incredible work around ensuring appropriate survivor care, making sure that safe homes have the resources, both through financial resources, but also through technical training and connecting to other experts in the field. And this year, in coordination with them, we've started this webinar series to talk about various policy issues that are really pressing within our field, within the field of human trafficking. And I'm so thankful to be joined by three incredible panelists that you will hear from today. First is Christine Reyno, Senior Director of Public Policy at Shared Hope International. I've had the pleasure of working with Christine for many years, and Shared Hope has really led the charge, particularly from a policy perspective, on our issue today, and that is safe harbor laws. We also have Dana Hunter, who is Executive Director in the Louisiana Governor's Office. And then last but certainly not least is Carolyn Palmer, who is a practitioner in the field. She is from the Minnesota Department of Health Violence Prevention Programs Unit, where she is really implementing Safe Harbor. So I'm excited to hear from her and how that implementation is going and what are the pros and the cons that they're running into. With that, I would like to welcome onto the virtual stage Christine Reyno from Shared Hope International. So Christine directs Shared Hope's policy initiatives to advance protective responses for child and youth sex trafficking survivors. She joined Shared Hope International in 2011 as part of a new domestic policy initiative and helped draft the legal analysis of the 50 states and District of Columbia that laid the foundation for the annual Protected Innocence Challenge report cards. And a huge congratulations to you. I know you worked on some new methodology. And so the report cards this past year have really, I think, reinvigorated the conversation around where we need to be moving forward in some of these areas. I'll tell you from a personal and professional perspective, I see Christine as the foremost expert on safe harbor across the country right now. I know she's been working passionately on it at the federal level and across the states as well. I'm a resident here in Virginia. I know we've been fighting for many years for it, and Christine has been a big part of that. Christine, welcome. So thankful for you to be here with us today. And I know that you have a little bit of presentation. I'd asked if you could just lay some groundwork and give us the overall sort of scope of what is Safe Harbor and what are we really trying to accomplish and the different types of safe harbor. We've had some new models emerge. I'll turn it over to you, and you just say next when you need me to click the next screen.
Okay, wonderful. Thank you so much for having me here. I'm really happy to be part of this discussion and really appreciate Safe House Project for hosting this conversation, because we're really happy to see this conversation being had and having opportunities to share the models and talk about what we've seen, that these laws have been developing for many years. The first Safe Harbor law was enacted in 2008. So I was going to just jump in and talk a little bit about what we've seen. Shared Hope has been looking at these laws since the inaugural Protected Innocence Challenge report cards were released in 2011. And of course, that research began in 2010. And for the last 12, 13 years of looking at these laws, seeing how this has developed, both as an idea and then as a legal framework. And so one of the things that has been really interesting to see develop over this time period is the fact that in 2011, when we released the inaugural report cards, there were only a handful of states that had removed some or all criminal liability for child sex trafficking survivors. And we really have seen over this time frame a real kind of shift. And part of what we saw alongside the development of the trafficking laws in 2011, there were also states that didn't yet have a trafficking law. There were states that also had not separated out the crime of child sex trafficking. And so we've really been seeing safe harbor laws, which are laws to prevent the criminalization of child trafficking survivors, evolving along with the field and along with the development of trafficking laws themselves. And so we have been looking at this through kind of a broader legislative framework, and the framework that, and Bill had mentioned, we recently revised. That revision really arose out of the fact that as we saw a lot of progress, states started out mostly failing, but then over 9 years, saw most of those states achieving A's and B's. However, they're achieving A's and B's without having a robust framework around victim protections. So criminal justice laws had really developed, and yet victim protections were lagging behind, in particular in the area of developing safe harbor responses. And with seeing that change, we saw the time to refocus our framework. And now this framework that you're looking at here, this actually represents, we're looking at really safe harbor frameworks. And I'll talk a little bit about the goals and what safe harbor is in just a moment, but we're looking at it through a lot of different lenses. We're looking at it from the lens of victim identification, because that's an initial threshold step of responding, but then also whether children face criminalization, whether there is access to services and a continuum of care, a broad range of available services with different ways to access those services, as well as whether there's screening and assessment within systems and training for those on the front lines of identifying child victims, and training to understand trafficking as that sort of threshold understanding this is a child who has been victimized and should not be encountering a criminalizing or punitive response as a result of that trafficking victimization. So I have three things I really wanted to talk about really quickly in terms of what are the goals of Safe Harbor, because this really, I think, is important for framing the discussion about what Safe Harbor is. And as I'll talk about in a minute, there's also been a shifting definition of Safe Harbor. Safe Harbor has a lot of different meanings. There are many Safe Harbor laws enacted across the country, but they can vary dramatically. So I wanted to start by looking just really quickly at what are the goals of Safe Harbor? What are we trying to accomplish? And this is Safe Harbor framework it's a legal framework, but it's also implementation, because a legal Safe Harbor framework really it's only as good as its implementation, which is why I'm glad we're talking about implementation today. But really at its core, we're looking as an initial goal at eliminating the criminalization of children for prostitution and ideally other offenses that are related to trafficking victimization. And so removing that criminal liability is at the core of this, because it really shifts the overall response. Where are we coming from in terms of responding to child trafficking survivors? But then we've also seen, and we're thinking back to implementation, another really important aspect of Safe Harbor and a goal of Safe Harbor is the reason that we don't want to send child trafficking survivors into a punitive system is because we really are looking to create a pathway to services that are tailored. This is the services that are appropriate to the victimization through trafficking, and recognizing that there are unique needs that child trafficking survivors need to have met. And so how are we connecting children with those services? And that is equally fundamental to a Safe Harbor response as removing that criminal accountability or criminal liability. But we are also seeing that how this is done, and really another sort of important goal of Safe Harbor, is to make sure that this is being done in a way that's sustainable and that is going to be effective in implementation. And so making sure that when we're talking about service responses, that there's really meaningful investment in funded services that are available in the community, and that we're not solely relying on systems to respond to this population. So what I wanted to address really quickly, going back to the definition of what is safe harbor. Safe harbor, I wanted to draw a distinction between kind of mitigating. There have been a number of responses that have developed over the years that have mitigated criminal liability rather than really looking for what is a true safe harbor response. Now, granted, when we look at the goal is to really fully move away from, not solely to address the harmful outcomes and consequences of a criminal response, which we do see there that can be addressed through things like diversion or allowing for arrest but then not prosecuting as a way to connect young people's services, or providing affirmative defenses. All of these are approaches that we've seen that have fallen under that sort of umbrella of safe harbor. However, these are still approaches that are relying on punitive systems, that are still sending that message to this young person that they are still somehow responsible for their own victimization, for their own trafficking. And it also really compounds the trauma that this young person has experienced and perpetuates that narrative that they have already heard from their trafficker, that they're not going to get support, they're not going to get help, that they're going to be penalized. And so continuing to rely on these processes, whether it's arrest, even if there isn't prosecution or there is a diversion, there are still harms by directing through these processes. And then also some other aspects too, where we're not really achieving a true safe harbor response, is also when protections are really limited to identified trafficking victims. There are a lot of safe harbor laws that have developed with a limitation. And I'll highlight how we're seeing this show up around the country, but one of the limitation really appears where there is a requirement that a child be identified as a trafficking victim in order to receive protection under the non-criminalization law or under the safe harbor law. And the problem that we're dealing with there is that rather than recognizing that any commercially sexually exploited child, so any child who's facing prostitution charges, there should be no additional step to determine whether that child is entitled to protection from being criminalized. If we're talking about a child being charged with prostitution, we're talking about a child sex trafficking victim. There is no sort of next, if this child is a victim of trafficking, determination that really should be made there. It really just creates another barrier and layer of limitation to connecting young people with those protective response. And again, just going back to the goals of safe harbor, providing immunity from criminalization on its own without access to funded services and the ability to provide an alternative response ultimately is not really serving all of the goals of a safe harbor framework, of establishing a safe harbor framework. And so I just want to give a quick overview of where we're seeing states and how this is developing around the country. So we have currently, there are 27 states and the District of Columbia that have enacted some form of non-criminalization response. So there has been a removal of criminal liability for child sex trafficking victims. As I mentioned, there are sometimes the way this is constructed, there may be restrictions. For example, if the child is found to be a victim of trafficking, again, not a restriction, a potential barrier to some children potentially accessing that protection. But there are currently, the majority of states have taken this step. As a result, though, we have 13 states that still have laws allowing a child to be prosecuted for prostitution. So the same crime that is synonymous with that child's trafficking victimization. And so, however, we do see other responses. And as I mentioned, there are diversion responses in some states. We also see states using an affirmative defense or a kind of a diversion into services, but again, through the route of a juvenile justice response or a discretionary referral rather than a prosecutor proceeding with the case, instead referring that child to services. Some of the concerns we have about this is that this is still using a coercive tool and potentially a punitive system to require a child to participate. And we're talking about a child who, as a result of their trafficking, has had choice taken away over and over again. And when we're thinking about developing a service response, we're really looking for that full response to not take away that choice and that ability to participate fully in their healing process. And so a few other stats that were important to the discussion today are that there's 30 states now. There are 28 states that have non-criminalization prostitution. There are states that actually have some other non-criminalization protections for offenses that are not prostitution, including in some cases trafficking. And this is something that we're seeing where trafficking survivors are being charged with trafficking themselves. And so we're seeing states start to develop protections around that, as well as some other crimes. And then affirmative defenses is another area where there's kind of protection beyond prostitution. But another sort of concerning statistic is that of the 28 states in DC that are providing non-criminalization protections, they are not necessarily providing access to services. And so there's 16 states that are not doing that. So I have on the services side, I have a video, but I think we could maybe skip that because I know I don't want to take too long, and I have some resources, but we can skip over those.
Yeah, and I think this shows such a great view of where we are in the country. We've seen great progress. I'm ashamed that my state is still orangish red because we're still not moving forward, although slowly but surely. But yeah, it just really shows that national framework. And so I wanted to move on to Dr. Dana Hunter. We see Louisiana being on this map as having alternative responses. And so that's always a good first step to where we need to be. Dr. Hunter is a native of Baton Rouge, Louisiana. And in February 2017, after serving in various leadership roles in academia and government, was appointed by Louisiana Governor John Bel Edwards as the executive director of the governor's office Children's Cabinet. In this role, she worked passionately to coordinate and align resources and policies to better outcomes for children in the state of Louisiana. And she worked closely with Governor Edwards and First Lady Donna Edwards to facilitate statewide anti-human trafficking efforts and the Human Trafficking Prevention Commission. On July 1st, 2021, Governor John Bel Edwards appointed Dr. Hunter as the executive director of the newly established Governor's Office on Human Trafficking Prevention. And Dr. Hunter has continued to just spearhead and be, quite honestly, a national voice on issues of child protection and response, and just a great deal of respect for her and the work that she's doing in that office. And then also her bosses as well, who have been very committed to this issue. And so, Dana, I wanted to ask you, we've talked about that national perspective, right? Narrowing down into the role of state government. Could you speak a little bit to how state governments, what their role is in ensuring systems respond appropriately to child victims of trafficking? And if you could also touch on what are some of the challenges to coordination, collaboration within those systems, and how does Safe Harbor fit into that, whether it's the concept or actual laws in some of those protections for children?
Yes, thank you, Bill, and thank you for having me and just the opportunity to share. So I will tell you that here in Louisiana, we started several years ago. So in 2012 to 2014, we saw an uptick in legislation to address human trafficking. Senator Ronnie Johns, who's now retired, he was very instrumental in just kind of really highlighting. So Safe Harbor was passed in 2013. Then in 2014, a bill was passed to legislate to mandate collection of data on human trafficking through our Department of Children and Family Services right after that. And so then it was like we began to now see and have data. I think the first report was in 2015, 2016 of what this looked like in Louisiana, because prior to that, folks didn't know. It really, human trafficking, commercial sexual activity among children really flew under the radar. And so with the passage of these laws, it then began to surface to the level of government to say, okay, how will we respond and how will we at this level address this issue? And now, as I came on, I was appointed by Governor Edwards to lead the Children's Cabinet in 2017. We had our first statewide symposium to address this issue, to educate the public. We invited key stakeholders and had over 400 plus folks in the room, judges, legal experts, you name it. And survivors spoke to say to all of us here in Louisiana, this is real, this is happening. And so we've seen over the last, from 2018 with the passage of Safe Harbor through now, we've seen government begin to respond in such a way that is now really putting Louisiana on a map. And I will say that one of the first responses from government was to create a model to build the state's infrastructure and to create a model. And we're so thankful that we're able to do that through funding through the Office for Victims of Crime, because prior to that, we didn't even have state funding to address the issue, state or federal. And all we had was laws on the books with no entity to enforce implementation. They were passed with no training, with no updates and all of that. With the funding from the federal government, we were able to then create a model, our Louisiana Child and Youth Trafficking Collaborative, to bring together all those key stakeholders, law enforcement, OJ, DCFS, FINS, our families in need of services, some of those key providers to say, look, we have to begin to work, one, leverage resources and work together. We have to understand the laws, train folks on the laws, and really look at what do we need, what services need to be put in place to protect our children. And so one of the things that we did through the OVC funding, we created trafficking specific multidisciplinary teams all across the state, really building a network in each region of the state to provide that community specific, region specific community response to this issue. And that was a game changer, because in many regions of the state, when a child victim was identified, people didn't know who to call. What do we do? Who to refer a child to? And so really beginning to create that safety net and that infrastructure in each region of the state, such that when a victim is identified, there is a response, an immediate response. So we created that immediate 24-hour response. Then there's a 48-hour response, a 72-hour response, so that child's case does not fall through the cracks. And that's been instrumental. And then because we were able to address this issue, in 2021, the legislature passed a law to create the Office of Human Trafficking Prevention, which I now lead. That's been a game changer. So we can see here in Louisiana, there's been such an upward trajectory and progressive nature of really saying, look, we know that this is here. We're now collecting the data. We now have a contract with Allies Against Slavery to help us collect the data, build out a dashboard. And so we're now beginning to see more and more what this looks like. Our numbers are increasing because identification is increasing. We were able to borrow a best practice screening tool from the West Coast Children's Clinic. So we've trained over 200 providers on how to identify this tool, how to identify this issue, how to use this best practice screening tool. We've recently developed a labor trafficking screening tool that we're now starting to vet and use. And so really over the years, we have been working with every partner. We have a network of over 700 key stakeholders, bringing everybody to the table to address this issue. And so that's been our role. We have through our office, we house the Human Trafficking Prevention Commission, looking at what are some of the gaps in our policies, what are some of the reporting gaps, what are some of the needs of services, gaps in services for victims. And one of the laws that we're very proud of, which was passed last year, was Act 130, which provides for post-conviction for relief for adults. And we're so thrilled to have this post-conviction relief for our adult survivors of human trafficking. So I'll pause there and let you give a follow-up.
Yeah, thank you. Thank you, Dr. Turner. I just want to say a lot of this has really been because of your leadership in the state. I know that you've been fighting very hard. And as someone who is a true believer in a coordinated collaborative response, I know that you've really been fighting hard to bring everyone to the table so that you can have these responses that make sense within the state and to continue to advocate for sound policies. Thank you so much for that. So, Carolyn, thank you so much for joining us. We're so thankful that you are here with us today. Carolyn Palmer, JD, is the Safe Harbor Director in the Minnesota Department of Health Violence Prevention Programs Unit. In this role, she manages the state's multi-sector response to human trafficking exploitation, both sex and labor, with a focus on youth experiencing sexual exploitation through age 24. Her responsibilities include oversight of grants for service providers, program evaluation, technical assistance, training, and policy development. And prior to joining MDH, Carolyn served as the Public and Legal Affairs Manager at the Minnesota Coalition Against Sexual Assault for over a decade. She's currently a Bloomberg American Health Initiative Fellow in the Violence Cohort at the Johns Hopkins Bloomberg School of Public Health, where she will earn her MPH in May 2023. That's exciting. Wow. Well done there. So yeah, I love when we're starting to bring in, it's interesting, bring labor trafficking a little into this conversation. I know Dr. Hunter was sharing a little bit about that. And so it is really encouraging because for so long, this was something that was really neglected in this space. We just really weren't talking about it. The other thing that I noted too, just through your bio and having reviewed the PowerPoints, is that you're really looking at service eligibility up through age 24, which is critically important. So often that key age of 18, people are aging out of different services and access to different programming. But I think we certainly have recognized at the federal level that inclusive of youth up to the age of 24, because they're still developing, they still have specialized needs that we're not seeing with other folks. Shared Hope says you're doing a great job and really want to highlight that model that you have there.
Great. Thank you so much, Bill. And thank you so much for Shared Hope for that vote of confidence. And also it's great to be here on the panel with Christine and Dana. Yeah, I will just give you a quick tour through our response in Minnesota. We have been in place with our safe harbor law since 2011. And just like other safe harbor states that recognize that youth under age 18 should no longer be criminalized for prostitution. And we really wanted to focus on that access for services and supports. But when the law passed in 2011, we recognized that our state wasn't fully prepared. There were some organizations in place, but there needed to be a multidisciplinary process. And that was called the No Wrong Door process. And that occurred for 3 years between 2011 and 2014. And that led to full implementation of our safe harbor response. And that No Wrong Door planning included child welfare, it included our public safety response, and really most importantly here in our state of Minnesota is our public health response. We have taken the stance that we want to center our human trafficking and exploitation response out of public health and then partner with all of our other folks in human services, in human rights, in public safety. But I think it's really helped to shift our conversation in the state to really talk about this as a public health model, looking at the trauma, looking at the after effects of exploitation and trafficking on health, not just on the individual, but also on communities. And we may still be the only state, or maybe there's 1 or 2 others that have their safe harbor approach based in public health departments. The other piece I wanted to highlight about Minnesota is over the years, we've been really partnering extensively with the tribal nations in our state. We have 11. We had a tribal summit as we started our work in our state, and we actually learned quite a bit about how we would work across governments, because of course, tribal nations are sovereign nations, and we are really through our state funding and our federal funding, partnering with tribal nations, but also taking their lead as to how they want to respond within their sovereign jurisdictions too. So that's been a terrific learning experience over the years as we've been building those relationships. You can go to the next slide. This is just a copy of our No Wrong Door report that was put together. This is available on our website, or if you want to reach out to me at the end, I'm happy to send any of these materials. And on the next slide, I also have included some other really key reports that were put into place in our response. These included a couple of reports by the Minnesota Indian Women's Resource Center, as well as the Minnesota Indian Women's Sexual Assault Coalition, that really dug into the impacts of trafficking and exploitation on Native American women and children. We also had a cost benefit analysis report put together for our state as well, looking at $1 of investment bringing $34 back in to the response for our state. And we've been very fortunate in our state to have a strong bipartisan response to human trafficking, which has led to good funding for our services. We know we are very fortunate compared to a number of other states in terms of how we can build our response with our resources. One thing I really want to emphasize, and we're hearing this from both Christine and Dr. Hunter as well, is the importance of statewide and local partnerships. So there are many different roles within our response here in Minnesota. In the Department of Health, it's where the Safe Harbor Director is housed, and we are responsible for our regional navigator and supportive services grants. We are tasked by the legislature to do a biennial evaluation, which looks at our services, how many people are being served, and also making sure that the services are doing what they're supposed to do. We also provide training and technical assistance, and we have an improving outcomes for trafficked and exploited youth grant from the Office for Victims of Crime, which has helped us expand to that labor trafficking response, because currently our state has been really focused on sex trafficking, although fingers crossed that will change this year when we get our first statewide labor trafficking services funding. We partner extensively with the Minnesota Department of Human Services. Their Office of Economic Opportunity manages all the shelter, housing, and outreach grants for Safe Harbor. And of course, they are the home of the child welfare response. They have a trafficking coordinator based there. And we also turn to the vulnerable adult system responses when necessary. In the Department of Public Safety, we have a human trafficking investigators task force, which operates statewide and also partners with a tribal sex trafficking response task force as well. The Office of Justice Programs is where law enforcement grants for investigation are based. And then just in the past year and a half, we have the first in the nation missing and murdered Indigenous relatives task force office that is in place. And we are starting to partner with them quite a bit more on the ground response. We have also partnered quite a bit with the Minnesota Coalition Against Sexual Assault on protocol development and multidisciplinary teams in 7 or 8 locations across the state. They just ended their contract in 2022, so we're in the process right now of filling that protocol development role with another organization that's really going to be focusing on training teams about privacy and confidentiality and how to work within their roles in a multidisciplinary setting. And then recently, we've really built up our relationship with the Office of the Minnesota Attorney General. They have just received funds for a specialized prosecutor in human trafficking. Because of our state law, they couldn't receive those funds directly, so they went through the Department of Health, and we helped them to get that set up with their prosecutor there. They also have an expungement program in place, which has been helpful in terms of responding to sealing of records. We don't have a vacator law in our state yet, but we do have some approaches that are helpful to victims of crime in terms of expunging their records. And this just gives you a picture of what the Safe Harbor network looks like. We have our regional navigators located throughout the state, plus a couple of regional navigators located on tribal nations. We do have these regions that I'm talking about. Really, these navigators that are located within each of the regions are the hub. They get referrals, they get people connected with services, they provide a lot of training and technical assistance. They are crucial to advising our work on the Safe Harbor level. And they also really help to connect us with survivor subject matter experts in the field so that they are more integrated in the work as well. And this just gives you the scope of our ongoing engagement. We are often meeting with our grantees and our regional navigators and really keeping a close relationship to them to hear what's happening on the ground and where we need to step in and look at any policy changes, where funding needs to be directed. We have an extensive data collection system here through the Minnesota Department of Health. Our prior evaluator built a custom database system for us where we can collect a wide variety of data now about the services that we're providing. And as during COVID, we weren't able to do as many site visits as we wanted to, but now that we are out of the woods there, hopefully we will be visiting a lot more of our grantee organizations in the tribal nations in the coming year. We are also focusing on a strategic planning process. Now that we've been around doing this work for over a decade, we are looking at how we can improve health and racial equity within the safe harbor system, continuing to just really build more opportunities for subject matter experts, leadership opportunities. We continue to hear their desire for shared power in the work that we're doing here in the state. And so we're going to be working extensively with our grantees and people with lived experience to build that. And then also just looking at the holistic health of the statewide network. This is difficult work. There's a lot of burnout. The COVID pandemic really put people through the ringer, and there's a lot of challenges. And so we need to also look at just the health of the people who are delivering the services in our state too. And just a couple of tools I wanted to mention. We do have a special tool that was created through our federal funding here called the Mighty tool. It can be used for youth or for adults. It was focused on youth, but really it's based on a tool that was used for adults, and it can be adapted in a number of different settings though. And it really is meant for folks who are not providing direct services in the human trafficking space, but want to know how to identify sex and labor trafficking and make those referrals to the appropriate safe harbor providers. And then we also have some additional tools on our website. One thing I wanted to highlight is we have put together a healthcare provider training. It's available free through the MDHE Learning Center. While it's Minnesota specific, really anybody can access it. We are required under state law to provide training for hotel licensees. And so we do have that material up on our website, and we're currently revamping it right now, and it's going to be available probably late summer in its new version. We also have some excellent outreach materials that were created for youth by youth on our website. And these are also the protocol guidelines that have been put together in our state. We have sex trafficking and labor trafficking protocol guidelines available either through our website, or again, feel free to reach out to me and I can share that information to you. These were put together as a result of state and federal funding, and they are meant to help different jurisdictions create their own specific regional area protocols that will work best for them. Next slide. And I just wanted to highlight, we are about to get our 2022 Minnesota Student Survey data, but we do have a question on our Minnesota Student Survey that asks high school students whether or not they have traded sex. And as you can see here, the race and ethnicity of the folks who responded yes. We do have some significant racial disparities in our state, particularly in instances of American Indian and Native youth, Black youth. And interestingly, even though you would think the metro area would be the highest percentage per capita, really our northern part of our state, again, with a higher populations of American Indian youth, are even more affected. So we're looking forward to getting our more updated data soon. And this just shows you also what we learned is that while a lot of our services and our messaging has been tailored towards cisgender girls, cisgender boys are equally impacted in our state. And we're seeing higher impacts for transgender and youth who may be other places on the gender spectrum. And we're also seeing a lot more yeses coming from youth who have been in systems such as foster care and correctional facilities. This is my contact information if you want to reach out. And thank you so much for the opportunity to present today.
Thank you, Carolyn. I think, actually, I want to get some of that data because I think that really tells an interesting message, particularly looking at the impact on Indigenous populations. I think that's something that is also coming into the limelight right now to really understand how it is impacting different communities in different ways. So that was really enlightening to see. It's almost double with that statistic. So thank you so much for that perspective, really digging in as a practitioner, somebody who's pulling the levers, so to speak, on the ground in Minnesota. That's incredibly important. I did want to just run back through the panel very quickly, starting with Christine. And Christine, in a minute or less, are there any sort of final words, wrap-ups, things that you wanted to just add in based on the other presenters?
Just really quickly, I think the one thing and we heard from both Carolyn and Dana is that the collaborative work across the state, especially with the regional approaches, is engaging across disciplines. This is really what we're hoping to see in every state, and I think it's key to effective implementation of Safe Harbor.
Awesome. Thank you. And Christine, again, thanks for your leadership on this issue over the past many years. and really pushing this forward from a policy perspective. Dana.
Thank you, Bill. And thank you, Carolyn, also for pointing out the work with the Indigenous population. So we also have a task force, Missing and Murdered Indigenous Women, MIWG task force, that we have launched. And so we're also really looking at how can we, with data collection, make sure we're representing our Indigenous people in our data that we're collecting, because our numbers show 0% or less than 1% of our population and victims are Native. And so we know that this exists in our Native communities, but we have to make sure that our data elements are there. So thank you for bringing that up.
Yeah. Thank you. Thank you for all that you're doing, and really as a model of collaboration, the work that you're doing there. And Caroline, any final words?
Yeah, no, I just wanted to echo everybody else. The collaboration is so crucial. We are constantly working with all of our partners on the state and local and tribal levels. And we wouldn't be able to do this work without everybody's input. It's how we strengthen our systems. It's how we learn. And yeah, I definitely want to echo what everybody else said. That's the top thing you can do in order to implement and develop your safe harbor response.
Yeah. No, I really appreciate it. And I love how you all are looking at it through that healthcare lens, right? That it is a public health crisis. I think that's critically important. The criminal justice sector certainly has to remain involved, but I think that we start to broaden that aperture a little bit to see the bigger picture and have higher level systems change. On that issue of the intersection with healthcare, please save the date. May 17th, we'll be doing our next policy webinar at 3 p.m. to talk specifically about the barriers to healthcare for survivors of trafficking. So that'll be another important conversation for us to have. I just wanted to say thank you to Safe House Project for hosting these discussions, these policy discussions that really drive where we go in the future. So proud to be able to partner with them and their continued leadership in raising these issues to the forefront and having these conversations. And thank you to all of you for being here today, for taking your time and out of the day to listen to this. Please feel free to reach out to any of us for follow-up, for information. Carolyn, I'd ask for your PowerPoint slides, but I already have them. I'm good. But if anyone else wants that data, please let us know. We're happy to share it with you. And any questions that you all have, please feel free to send them our way and we'll get them answered. So have a great afternoon, everyone. Thank you.